Good afternoon, Madam Chair and members of the committee. I'm Penny York. I'm president of the Corvallis City Council. In 2011, the council passed a resolution supporting single-payer option. But I'm speaking here today from the perspective of a mother whose family was devastated by a catastrophic medical event, an event made worse by our country's dependence on employment-based health insurance. In 2009, my 36-year-old daughter, Christy, who was head teacher at a local charter school when she was diagnosed with a large tumor pressing on her brainstem. A few hours after apparently successful surgery, she started to bleed in her brain. She spent 3 weeks in intensive care and had 3 more brain surgeries. Would she live? What would her condition be if she did? My husband addressed the financial issues. Her nonprofit employer extended her health insurance 1 month. How long could we continue to take money from our savings to pay her mortgage? Would she have to declare bankruptcy? After 5 weeks, Christy was able to go to inpatient rehab. Adequate health insurance pays for extensive rehab for brain-injured patients. Her insurance paid only $25,000 total, while the rehab costs were $1,200 a day. So we moved her to a skilled nursing facility. Therapy equipment was inadequate. Her caregivers were overworked. Her therapist had no special training in brain injuries. When I was able to bring Christy home from Corvallis, I did her application for Social Security disability insurance and learned that it would be over 2 years before she would be eligible for Medicare. So for 2.5 years, my husband and I paid all of her medical costs, her private insurance premiums, her co-pays, her assistive equipment that wasn't covered, and during that time we provided her care until she was able to care for herself. It could have been worse. Christy is walking now without a cane. She just started teaching again part-time. While she has special health care needs and she has long-term disabilities, she's doing well. But it shouldn't be this way. When my husband and I were terrified about losing our only child, he shouldn't have had to spend hours on the phone with an insurance company trying to explain why an out-of-plan neurosurgeon had performed an emergency brain surgery on her one night. Of course, the reason he did that was he was the neurosurgeon on call, and he saved her life, and had he not been there, she would have died. They denied the charge. People with disabilities who are unable to work shouldn't have to wait 2.5 years for Medicare. Medical care should be based on medical need. I urge you to support Health Care for All Oregon. Thank you.